Welcome to the Virtual Control Mechanisms Physiology Classroom. In this video, we'll be completing the Cardiovascular Physiology Laboratory. We will begin at Activity 3 of the workbook, where we will look at cardiovascular control and regulation. This will consist of examining the respiratory pattern changes during a Valsalva maneuver, postural changes, and thermoregulatory changes. To begin with, the demonstrator is preparing a 3-lead electrocardiogram, or ECG. He's initially applying an electrode gel to clean and abrade the skin at the site of the electrode. The electrodes are applied to the palm side of the wrists and median border of the ankles, as well as in the fourth intercostal space to the anatomical left of the sternum. The earth lead is attached to the right ankle to disperse electrical charge that may cause interference in our results. Here is an explanation to the appropriate placements of the leads in order to get differing views of the ECG. This is the normal output produced by the PowerLab software showing the participants' resting ECG traces. This shows the individual P and T waves as well as the QRS complex. This diagram provides an explanation of an ECG trace showing the initial P wave denoting atrial depolarization, followed by a rapid QRS complex which demonstrates the large ventricular depolarization and the subsequent blood ejection from the heart. This is then followed by the T wave showing ventricular repolarization. In this activity, we'll be using the ECG to calculate the cardiac frequency and the R to R interval as seen on this diagram. The demonstrator will then take the participant's normal resting blood pressure measurements. The participant's cardiac frequency, presented as pulse rate, R to R interval, and blood pressure are recorded here under normal sitting conditions. The systolic and diastolic blood pressure can then be used to calculate mean arterial pressure. These results are to be recorded into the table on page 14 of your lab books. The following activity will assess the impact respiratory changes have on cardiac control. The participant will perform the Valsalva maneuver. This is a forced expiratory effort against the closed glottis, aimed at increasing intrathoracic pressure. The participant aims to conduct a forced exhalation with no change in lung volume. As the participant performs the Valsalva maneuver, the demonstrator begins the blood pressure measurement. The maneuver is held for 15 seconds. On the ECG trace, you would expect to see an increase in cardiac frequency and a decrease in the R to R interval. Furthermore, the participant's results show a decrease in systolic and diastolic blood pressure and a reflex tachycardia response as a result of the impeded venous return. As a compensation mechanism for a decrease in blood pressure, the heart responds by an acute elevation in cardiac frequency in attempts to reach homeostasis. Part B will assess the impact postural changes have on the cardiovascular system. The participant maneuvers from supine to standing position, preceding collection of blood pressure and ECG data. Following movement from supine to standing, an increase in cardiac frequency with simultaneous decrease in the R to R frequency is observed. The blood pressure reading demonstrated a decrease in both systolic and diastolic blood pressure. This drop in blood pressure is consistent with orthostatic hypertension. This is the accumulation of blood in the lower parts of the body as a result of gravity initiating a decrease in venous return and a subsequent reduction on cardiac output. We therefore see an increase in cardiac frequency to compensate for the decrease in systolic, diastolic, and mean arterial pressure. The final part of Activity 3 is looking at the impact thermoregulatory mechanisms have on the cardiovascular system. The participant's baseline sitting data is acquired again after resting for 3 minutes. Her R to R interval, pulse rate, and blood pressure are all recorded and noted in the table on page 14 prior to conducting the cold pressor test. The participant immerses their feet in cold water. Blood pressure measurements should be taken as soon as possible after the subject has immersed their feet. For comparative purposes, you compare against the sitting data. We see a decrease in R to R interval as a result of the sympathetic nervous system vasomotor response. Cold and pain receptors cause systemic vasoconstriction that results in a spike in total peripheral resistance. This rise in total peripheral resistance causes a proportional increase in systolic, diastolic, and mean arterial pressure. Additionally, cardiac frequency increases as a consequence of this sympathetic response.